Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
We're going to start today with something that is very interesting. I will share with you a case about a small child that when you see the child before we have started treatment, you will really feel very sympathetic towards that child. If we can play the images, then we'll show you how the child looked like when she came to the hospital. As you can see, this is the hand, and the hand is very thick. The skin on the hand is very thick. And you can see also here, very thick skin, like the girl is about 100 years old or so. That is the skin of a 12-year-old. That is the skin. Look at the neck, and look at the hyperkeratosis, look at the folds of the neck. Very bad, very thick skin, and very foldy, and very black. And if you touch it with your hand, look at the forehead. Focus on the forehead. And you see the folds of the skin. You see the folds. The skin is folding as if she is a very aged woman. The skin is very bad. Look here. The same thing. The skin is very thick and very aging. The skin is like 100 years old. And now this is severe fungal infection that has been extended to this poor girl from her feet all the way to the head. Look at the forehead. Look at the folds of the forehead. And you can never, if you cover the face and only show the forehead, you will definitely say that this is a patient that is above 60, 70 years old. So the skin was very bad. The skin was very bad. This is how she came in. So she came in, the skin is extremely thick, and hyperkeratosis, meaning very dark black spots, especially at the area of the elbows and the joints where she can look at the arm. This is the area where she flex and extend at the level of the elbow. Look how black it is, and look at the folds. This is hyperkeratosis in a 12-year-old. And this, she has been suffering this almost since very young age. Been everywhere, done everything, nothing, no resolve. She came, she stayed with me for about a week. I mean, in and out. She come and take the treatment and go. Now, what is this case? What is this case? What can happen? What can cause this child to manifest like that? That is extensive fungal disease. Extensive fungal disease. Usually, when we get any fungal infection, our immune system, yeah, that's good, is enough. Our immune system can fight it. But sometimes when we are missing a component or two in the immune system, our immune system can no longer fight a fair fight whereby we can get rid of those fungal infections. That's one reason. Especially if this scenario exists since birth. Second possibility is she had the fungal infection, but she has never taken the correct treatment. So the fungal continue to grow till it includes everything in her body. Now this is devastating, especially for a child like this that goes to school. I mean, you can imagine that, you know, she is not very happy because about the way she looks. She's not, you know, among her friends and in classroom and all. It's not very nice to have such a skin and such looks. You will be bullied from here till next year. I mean, and the girl felt really bad. So we're talking about not only physical appearance that is distorted, but we're also talking about emotional damage to that little girl because of the way she looks. She came in, and now I want to show you, after 1 week or so, 1 week, 10 days of therapy, I want to show you the new skin. How does it look now? How does she look now? Now, the skin is clearing up. Look at the neck. Is no different. Look at the forehead. All those folds at the level of the forehead are already gone. Is no more there. Look at the forehead, how shiny it is. You see the forehead, how wrinkled it was before the treatment? And look at the forehead, how shiny it is, and no more folds, no more wrinkled. The girl looked like a 12-year-old, not like before. Look, even the smile to her face. So her new look now, you know, brought her a smile, and this is what she was missing. She's a child. She needs to feel good about herself. The family wouldn't believe even the transition that she has gone through from a very aged looking skin, very thick skin, very infected skin, to the new look. Everything has cleared. In a matter of less than 2 weeks, everything has cleared. Focus on the forehead and you see there is no more folds. There is no more wrinkles on the forehead, and that is amazing. That is amazing. So all we had to do is identify the microbe and then have the correct medication for the microbe. We infuse her with some medication to make the skin brighter, looking better, and remove all those antioxidants. When the skin gets wrinkled like that and the aging spots appear on a small girl like that, we have a lot of toxins. So the best thing to do in this case, beside killing the microbe, is to give an antioxidant treatment. This is before and this is after. Thank you very much, Johnson. I appreciate that. I was exactly looking for that. Now this is a picture. Put this side to side. You see, this is, look at the forehead before the treatment, how wrinkles it is. Look at the aging of that girl. And look now, about 2 weeks later, after treatment, look at the forehead, what it looked like now. You see the big difference. You see, it's totally amazing how we can transform a patient like that with all those folds, with all this infection, with all this hyperkeratosis, which is the thickened skin around everywhere, to now. That is totally amazing because the girl, not only that the girl is relieved from the sickness, but the girl had a smile on her face now. She can go to school. She no longer can be bullied because she complained too much. Doc, I don't want to go to school anymore because the way I look. The family took her everywhere possible. No avail. Nothing can happen. Nothing can solve her problem. Now we can see together, all of us, that this is a really a miraculous transition from where she was to what she is right now in less than 2 weeks' time. With the correct medication, correct diagnosis, correct medication, everything can, above all, of course, the help of God, everything can happen. So this is a good story that I like to share with you before we start our session today about different things. So the disease was fungus, namely tinea, among others. So when we use the same medication over and over, here they use fluconazole, they use ketoconazole, they use this kind of drugs. Over years and years and years of using the same drug, the microbe is resistant. It doesn't work anymore, plus the side effects. So it has to be time then for a new medication that the microbe doesn't know and cannot fight it, because every time you use the same medication over and over, the microbe develop resistance, meaning you give the old medication that you always give, the microbe will take it, eat it, and thank you. Thank you, doc, for giving me the medication. But now we have to think what can be done to give this patient a medication that the microbe is susceptible to, is no longer resistant to. So we have to give a medication that is, meet, meet our goal, that killing the microbe with the least possible side effect, because you cannot, normally with fungal infection, you have to give the medication for a very long time. And if you give fluconazole, ketoconazole, or any of those ordinary drugs for a long time, the patient will suffer a lot of side effects that we do not want. So we have to think about a way to get this patient medication. Actually, I give her IV, some few medication, and look at the transition. Amazingly transition from a very sad girl to a very happy girl, and the skin folds now has cleared. The aged skin, hyperkeratosis skin, dark skin, especially around the neck and around all the skin folds like the elbows and the legs and the knees, everything has cleared up, and the girl is very happy. Still, I'm not saying that is 100%, but at least we changed the looks. We thank God for that. We changed the looks, and she has to continue on skin hydration, and we have to also be on the lookout for anything that might attack again. So this is a happy case that we have solved very successfully, and we thank God for that.